How do you spot respiratory distress in a child with bronchiolitis? Imagine trying to breathe through a narrow straw. That's what a child with respiratory distress from bronchiolitis might feel like. When a little one is struggling to breathe, certain signs become very clear. One of the first clues is rapid breathing. If a baby is taking more than 60 breaths per minute, especially if those breaths are shallow and quick, it's a sign they are working hard to get enough air. You might also notice the effort they put into each breath. Look for the chest or ribs pulling inward during inhalation, which shows they are trying to draw in more air. Sometimes, the belly moves more than usual, indicating extra effort to breathe. Nasal flaring is another important sign. When a child's nostrils widen with each breath, it's because they are trying to pull in more air through their blocked or inflamed airways. You might also hear wheezing or a high-pitched squeaky sound when they breathe out. This noise suggests narrowing of the airways, which is common in bronchiolitis. Grunting during exhalation is also a sign that the child is trying to keep air in their lungs, making a small, raspy sound. Watch for color changes too. If the lips, skin, or fingernails turn bluish or gray, it means their oxygen levels are very low. This is called cyanosis and requires immediate medical attention. Poor feeding or refusal to eat can also be a warning sign because breathing becomes too difficult for the child to manage both eating and breathing at the same time. If a child appears very tired, weak, or is difficult to wake, it indicates they are not getting enough oxygen and need urgent care. Lastly, if they are too breathless to speak or cry normally, that's a serious sign of respiratory distress. Recognizing these signs early is crucial. If you notice any of them, especially in very young or premature children or those with other health issues, seek medical help immediately. Bronchiolitis is caused by a virus that inflames the small airways in the lungs, leading to mucus buildup and airway narrowing. Early symptoms often look like a common cold, with a runny nose, cough, and mild fever. But as the infection worsens, breathing can become labored and difficult. Monitoring your child closely for worsening cough, wheezing, or signs of distress can help ensure they get the care they need. Medical professionals might provide oxygen therapy or hospital care if the breathing problems become severe. Remember, timely medical attention can make a big difference in managing bronchiolitis safely and effectively. Always trust your instincts and consult healthcare providers if you are concerned about your child's breathing.